Hello, hello, hello. I could well be streaming now, but I'm not quite certain. So I've got this new equipment, everybody, which gets me streaming. Yeah, it looks like I am live. Hold on. Browse. Right, I don't know what's going on here. Yes, I think I am streaming. There we go. I've been streaming for 58 seconds. That is awesome. Right, let's see if I can. I don't know if I can see the control panel. The streaming control panel. Right, everybody, good evening, and it is Monday the 7th of November, and welcome to your question and answer session. Now this is streaming at two places. It should be streaming on YouTube and also in my private group. So on the YouTube channel, there's been some comments and questions for the Q&A, and the question is a couple of people that haven't been to a chiropractor before have been asking what to wear to chiropractor and what happens at the first visit to the chiropractic office. And this video, or in this transmission, I'm going to answer that. So first of all, I'm going to talk about what happens at the first visit, and at the end I'll wind up with what to wear to the chiropractor, and I'm also going to give you some more resources, so just stick around to the end and we will get those to you. Okay, so what happens at the chiropractic visit? So prior to coming to the chiropractor, you should have been reached out to by us. Okay, we would normally email out the paperwork. Now it's vitally important because it takes some care to finish the paperwork completely. We go back in your history, asking about the sorts of stresses your body's been under since you were a child, as a young adult, and obviously later on in life as an older adult if you've got to that stage of life. We're interested in all those different phases of care. So the bicycles that you've fallen off, the trees you fell out of, the car accidents you've been in, the physical, chemical and emotional traumas that you've been in over that period. The reason we're interested in that, it gives us clues towards what's going on. So even before you enter our office, we should have spoken with you, explained what's going to happen, sent you an email with that paperwork in. You can either print it out, fill it out by pen, or if you wish, you can fill it out online and then email it straight back to us. Okay, and when you come in, when we email you, we'll give you directions so you know how to find us. If you have any questions, then do give us a call. Often we'll ring you the day before just to check and make sure you had any questions about the paperwork. Okay, if you have any questions about how to get here, and again, if you've forgotten or you don't recall exactly what's going to happen at the meeting, the first visit in our office. Now, caveat. Offices vary from place to place. Whilst the principles remain pretty much the same, the actual procedures can vary from practice to practice. So I'm talking about my practice. I will give you a little heads up of where this may vary in other practices and the sorts of procedures you might have depending on what office you're going to. But this is I want to keep this specific to my office, but where I know it can be kind of generic, I'm going to let you know. Okay, so you've got the paperwork, you've filled it out, you either bring it in by hand, and when you come here, we're going to meet and greet you, and we should greet you with a big smile and use your name because we love using people's names. If it's raining, we've got footwear outside that you can wear in the practice, so just slip your outdoor shoes off. We've got Crocs in the practice. Come on in. In the winter, we've got steam heating system on, so it should be nice and warm and toasty. And in the summer, obviously the windows open, we've got AC in the office turning and burning. So when you come in, in our office, you come to the left, it's our reception, our education area. So just go in and see our assistant, or if you see our assistant, and they're going to take the paperwork from you. They're going to go through the paperwork, and they're going to just make sure that all the boxes have been completed properly, and that if there's anything that isn't clear, she doesn't understand, she's going to get you to fill it in at that stage. We ask you to come in at a certain time. This normally allows 10 minutes just to do a little bit of admin, that sort of thing, like to fill out the paperwork, and then we give you a little tour of our practice so you know where everything is, so you can get stuck into it as quickly as possible. Okay, so after that, I have a look at the paperwork, or my wife, the other chiropractic doctor, is going to have a look at the paperwork. We go through it in some detail before you come in, because we want to mark out areas where we need further clarification. And then we sit down with you and we have you explain to us in your own words what your biggest concerns are, what the biggest health challenges you have are, and areas where you'd like to achieve certain goals. Okay, now very few people come into us thinking, oh, I know, in 5 years time, I'd like to have lost 10 pounds and be running 4 or 5 kilometers every other day. Most people come in with a neck pain or some sort of pain that they want to get rid of, but the fact is the pain is really a side effect. The pain is the result of the problem. It is not the problem. The problem is imbalance in the body. Our job is to identify how we can get you healthier, primarily through chiropractic adjustments. That's what I do, but there are other things that you can do. And also, what do you want to achieve? So understanding what you want to achieve in the future is really, really important. I'll be back in just a sec. So one of the big parts of the paperwork that we do when I'm sat down with you is to find out what your goals are. The sort of things are like, do you want to travel? Do you have children to look after for the next 20 years? Do you have grandkids you want to play with for the next 20 years? I personally look to my children's children. So I want to play with my great-grandkids now, because my children are older. They're going to be having children soon, so it's not my grandkids I'm looking for. I want to look at my great-grandkids, so that's going to be 25 plus years down the road. Okay, I'm 50 now, so that'll be 75, 78. That's reasonable. I should be around there. I want to be active. I don't want to be through lack of healthcare. I don't want to be crippled or in some sort of living a substandard life, a subpar life, just because I haven't taken care of myself. So we just encourage you to think about that a little bit. So anyway, having completed the paperwork, and we're talking about the paperwork now, we go through your goals. I just elaborate on any accidents you might have, elaborate on any red flags I might be able to see. And having done that, I'm then going to spend 5 minutes with you explaining what I actually do here in this office. My mission is to help you and your family do what you love for longer. That's why I explain to people right off the bat. Obviously, I understand they're coming in for some sort of pain relief in most cases, and they don't really understand the capacity of chiropractic care to improve their lives. So I spend a little bit of time explaining how the body works, what I do to help the body work even better, and we then get into looking for imbalance in the spine. My job really is to remove imbalance in the nerve system, primarily the spine, but there are other areas where it can happen, and I can identify that. And also the really cool thing on the first visit, I can show you it. I can show you by doing muscle tests that you experience, that initially it's weak, and then I interrogate the segments of the spine, and then it gets stronger. And in about 8 out of 10 people that come in, they see a really big difference with the finger strength. When we hit the subluxation and we make a challenge, or we make a pseudo correction, we actually see the finger strength getting stronger. It's not me that sees it, it's you as the person that comes into the office. So that's really neat, because often that ties into what the person's complaint is or what we've identified. We do a posture check, so we want to see how your posture is now, and then obviously we're going to check it again later. We do bilateral scale check, which is just to see how the weight distribution is. We also do a number of digital scans. The first one is range of motion. Okay, so we want to see how the range of motion in your neck is. The reason for that is we want to know how reduced it is at this stage. How degenerated isn't the right word. We want to see how impaired it is. That's the correct word. We want to see how impaired that motion is, and we look at rotation, we look at extension and flexion, and we look at lateral bending as well. Okay, so we get a measure of that, we get a digital picture, and the power of that is we've got it now, and we can do it again in 12 visits time, and we see what's changed, and then we do it again in 12 visits time, we see what's changed. And the really cool thing is most people see a gradual improvement as they go on. So that's really neat to see, and we've got that all recorded. Okay, and the last scan that we do is the nerve system scan. It's where we scan the spine. We're looking for temperature differences on the left and right of the spine. Now, why are we looking for that? We use a super sensitive thermometer to scan the spine, and where there is a hot spot, that gives us an indication that there's nerve system interference. In this chiropractic office, we call that a subluxation. That's the chiropractic word for nerve interference in the spine. So if there's a hot spot, it gives an indication that there's nerve interference, and we get a pattern. And what we want to see is if there are large spikes in the pattern, the next time we do it, we want to see those spikes drop down. The other thing is we actually want to see the pattern change in shape. So if we've got a lot of red at the top left, the next time we want to see it reduced, and we actually want to see the pattern changing, so it isn't the same pattern, okay? Because a healthy nerve system changes regularly and can deal with subluxations, and they actually move around depending on what the stresses are, the physical, chemical, and emotional stresses. So, having completed that nerve system scan, I then do the most important thing in my book, and that is a hands-on physical examination of the spine and the nerve system. What I'm doing is I'm assessing the nerve system by leg lengths, because people often say, oh, Dr. Craig, my right leg is a centimetre shorter than my left because a previous chiropractor said that. Well, that may be true, but that's only a centimetre short because the nerve system wants it to be in that position. In other words, if the nerve system in the pelvis is out of balance, then of course it's going to adjust the position of the pelvis to balance the legs in the best way it can see. So when I have you laid down on the table, I do my checks, I actually make some little impulses while I'm doing the assessment, and the legs can go from being an inch out of balance to bang on in balance. So this stuff is really powerful because I'm seeing this all the time, and then we're assessing, and then I assess the spine, I feel up the spine, I'm looking for these subluxations. There are 3 ways that they appear. They appear muscularly, so in other words, in fact, let's start at the beginning. The nerve system imbalance, okay, the nerves can be out of balance, so the leg lengths are different, the arm lengths are different, okay. The nerves, of course, control muscles, so as I'm palpating up the spine, if I'm feeling muscles that are in spasm, that have been in spasm for a while, I read that as a subluxation issue, in other words, a nerve system issue. The nerves are out of balance, so the muscles are out of balance. And then again, the balance of the body or structure. In this case, I use arm lengths as well to test if C1 and C2 are out of balance. I use leg imbalance at the bottom of the spine to see if the lumbar spine, the lower 5 vertebrae are out of balance, okay? And then on completion of that, if I have indications, we're going to take x-rays, okay? Typically I x-ray the neck and the pelvis if there are indications. Okay, indications could be things like the neck isn't moving properly, the pelvis, so the range of motion is badly restricted, over the age of 50, accidents and over the age of 50, or just accidents. There are a bunch of indications. If I look at the back of the neck and I see a crease across the back of the neck, that to me is a big indication that down under the surface there is degeneration, some serious degeneration going on. And then if I'm springing on the pelvis and the right side springs really nicely, the left side not so much. And when I do the pelvic analysis, the posture analysis, if one side is down more than the other. And then of course the history gives me loads of clues. So this is like collecting together loads and loads of clues on this first visit. So that's one of the main things that happens at the first visit, is the collection of clues to identify where the main weaknesses in the structure and nerve system are. Because you could have pain in your lower back, and when I check you, one of the biggest areas that have a problem is the neck. And of course, as the neck comes forward because of the issues, even though there's no pain here, you could still, that neck curve changing actually changes the mid-back curve, which is going to change the pelvic curve, the pelvic positioning. So now, if the pelvic position's out of balance, then the nerves come down to the lumbar spine, the lower spine could be in trouble. Okay, so I trust that makes sense. So then we go for the x-rays. So typically I'm going to take a lateral and an AP view. AP means front to back, lateral means to the side. Cool thing about x-rays, when you take a picture of an x-ray, it actually shows all the features on the front and all the features on the back squished together. Okay, so in other words, when you look at the x-ray, although I shoot it this way, on the back of my neck, so my vertebral bones look like this, so you're getting an x-ray through there. But on the back of the vertebral bones, you have these spinuses. So the picture will actually show the vertebral bones, and you'll actually see the spinous pictures here, because there's a two-dimensional x-ray of a three-dimensional person, which is why you'll always, if you have an x-ray taken, if you're getting this view taken, you've got to have this view taken. So this is called AP, anterior to posterior, or front to back. This is called lateral, okay, from the side. So we're going to take AP cervical, lateral cervical, and I'm going to take AP lumbar, lateral lumbar. When I do the analysis, if I see a scoliosis, that is a deviation away from the vertical. Ideally, the spine is nice and straight up and down from the C1 all the way down to the L5, and the sacrum should ideally be straight. I don't know the percentage of people that actually have scoliosis. I think it's around about 20%. But anyway, a lot of people have a deviation from the midline. Some very considerable, some just slight, some so considerable that you can actually have bars have been surgically fitted to stop the scoliosis progressing so far that it causes, permanent damage to organs. So they can be quite extreme. But anyway, when I look at the neck and the pelvic x-rays, if there seems to be a deviation, then I will take thoracic x-rays just to get the whole picture. Okay, so that is what happens on the first visit. And then in our office, I need time to put together all that information. I put together the information in a pack. And the pack looks like this. In here you'll have the x-rays, you'll have all the scans, there's some admin letters. I write down, there's some pictures of different subluxation degenerations. I give you a couple of pictures of the x-rays. The x-rays are on the computer. If you wish to come and sign, you can bring in a stick and take those x-rays. They are yours. So so the follow-on visit is where we go through all the details. I show you exactly what we found. I look at it in a lot of detail. It takes me about an hour and a half to do the work, and then I put together a plan of what I would do in your situation to get the very best results. And if we take you up for care, we just get going straight away. Okay, we start get going with the adjustive care. Now, what to wear to the chiropractor? Okay, so we've actually got everything you need here. Even if you came in completely inappropriate gear, we've got gowns here, so that's not a problem. And but if you wanted to be comfortable, I'd suggest, you know, just wear comfortable clothes, stuff that you can bend in and move around in. I mean, we're not having you lie on the floor or anything like that. We may have you bend forward all the way and then range of motion with the neck. So it doesn't have to be super rough, but if you want to feel free to move, then a lot of people wear sweatpants. That's very common. And, you know, just a stretchy top or a t-shirt or something that you're comfortable with. It doesn't have to be too formal. Obviously, shirt and tie, we're going to have you take your tie off and all the rest of that because we need you to move. One thing of note, in the x-rays don't pass through metal, okay? So if you have some, we're most likely taking an x-ray of the neck and the pelvis. If you have some piercings that maybe you don't want seen or they're going to interfere with the x-rays, then take them out, okay? Earrings, you can usually just take them out quite quickly if that's possible. If you really can't get them out, then we can most likely work around them. We'll take an image and just make sure we've got all the information that we need. And yeah, things like probably don't start with a short skirt, okay? Even coming in for an adjustment on a regular basis, I do have a gown that I can lie over people's legs so that I don't embarrass them if they've got a short skirt on. Or if you come in and you've got one of those short skirts that has shorts underneath, just let the chiropractor know so that he knows he's not going to embarrass you if he does a certain adjustment. But that isn't usually an issue on the first visit. In our office, we do ask you to take your top off and leave your pants on, put a gown on, obviously while we're out of the room, and then when we come back in, I scan the spine. So best not to have a dress on, because we don't really have shorts here, although we can give you a gown to wrap around your waist so we don't embarrass you. But in that case, if you just had like separate pants and top, that would make it a lot easier. And like I say, not really a short skirt. Okay, but other than that, you can get away with generally anything to wear, but it's something that you're comfortable in, you feel at ease, and that's really the important thing. Okay, so that's what to wear to your chiropractor. That's what happens at the first visit in this office. Now, other variations may be in another office. They may send you away for x-rays. So you finish the visit here, you go away for the x-rays, and then you come back for the reports. Okay, that's obviously going to add a bunch of time, and that indeed is what we used to do. But because there were so many delays, it was ridiculous. People were waiting 4 hours, and that was not good enough. So we installed an x-ray machine. Okay, other things, some offices, I don't believe, or I'm told by my practice members, they're not as thorough as far as the scans and such like go. So a lot of that might not be included. I can't really speak. The people that I go and see are very much like me, so they have a lot of the same stuff. And what else? Yeah, I think that is just about it. You know, it's best if you can go on your own. I know some people have children and it's much more difficult. For us, it's very easy. The second, third, fourth, etc. visits, you can bring children and even little children, because my assistant, she's very, very good at looking after kids. We've got playrooms. But probably the first and second visit, you want to come on your own, okay? If normally you've got children, just see if you can get someone to babysit them, just so you can focus on yourself 100%. You're not worried about what they're doing outside the exam room. And you know, if you want to bring someone along for support, that's fine as well. Okay, so I trust that has been pretty in-depth for you. So we've covered what to wear to your chiropractor, what happens at the first visit. Okay, guys. If you have any other questions, this is your Q&A session. I run them most Mondays at 8 p.m. I do it on our private Facebook group. I'm also now streaming to the YouTube channel because there were some people that were very reluctant to use Facebook, and I get it, which is why we're streaming out to YouTube now. And if you have any questions, pop them down in the comments. If you are watching this on YouTube, then hit that like, hit the subscribe. In fact, if you're watching it on Facebook, do that as well. Hit the like and let your friends and family know about it. So I trust that's been of use. If you have a question or any other questions you want me to answer in the following Mondays, then just fire them down below. Have a great night. Have a great week. I look forward to seeing you around. Dr. Craig out.